go ahead for your opening statement for 3 minutes. Thank you.
Assalamu alaikum, everyone. I would just like to again start with the offering condolences to Dr. Aftab and Dr. Javed Suleiman, the sad demise of their sons. My name is Dr. Lubna Naeem, candidate for Appna President-elect. I'm coming up through the ranks and have served as a treasurer and secretary for Appna, and now I'm requesting with great love and respect the honor of your vote as President-elect. For over 2 decades, I was grateful to have a role as a servant leader, which gave me the opportunity to work on health and well-being of women, children, and minorities. Had the privilege to lead many Appna successful public health awareness initiatives as chairperson for Women and Children Affairs Committee, including childhood obesity, breast cancer, child sexual abuse prevention, Appna CDC multi-drug resistant typhoid awareness. For this work, had the opportunity to receive many recognitions and honors, including President Obama Award for Outstanding Volunteer Service. Among other achievements, record meeting revenue more than $1.5 million in 2018, record market growth profit on asset portfolio, which enabled the organization to utilize funds during pandemic. I inaugurated Appna's physician career portal as a resource for job posting and practice development, did legislation on anti-harassment policy for women to provide level playing field. As a result, we see many women physicians in leading roles. I have roots in American Medical National Organizations. I'm a board of director for Bexar County Medical Society and delegate for TMA. Our work mostly involves working with legislators on physician issues, such as mid-level scope of practice, prior authorization, telemedicine, to name a few. All throughout my executive positions, my work mostly revolved around Appna's mission of promoting health, medicine, and social well-being of the communities. Our predecessors, such as Dr. Arif Muslim, Dr. Aisha Zafar, Dr. Atiya Khan, all these good folks, they have done a tremendous job laying a solid foundation. It's time to move forward. It's time we mirror other professional organizations and work towards futuristic goals for our future generations. It's time we have a seat on the table and make Appna visible in American medical national scene. It's time we work diligently with ECFMG accreditation on Pakistani medical schools through WFME program. Empower chapters oriented community volunteering for meaningful grassroots impact. I'm confident.
15 seconds, please.
I'm suited most to uphold the vision and mission of Appna. When our juniors see that we have shifted our focus from internal politics and we are spending more time promoting science, medicine, and their professional development issues, they will join us in great numbers. The size of our membership will drive our success, and that's
Thank you so much, Dr. Naeem.
I humbly appeal to your greater intellect to consider my proven success record.
Thank you. Thank you, Dr. Naeem, for your opening statement. I will ask the same question to now Dr. Lubna Naeem's turn. The question is, in your opinion, what are the 3 most common negative feelings/impressions an Appna member and or non-member physician of Pakistani descent has about our organization, and your suggestions to reverse this feeling? Go ahead, Dr. Lubna Naeem, please.
Thank you, Dr. Sabat. First of all, I would like to condemn this negative campaign that has been floated in various social forums by one of the candidates against me and Dr. Asif Mohiuddin regarding what just Asif Mohiuddin just said. And this is very unfortunate, and that is probably the top reason why Appna members are disgruntled. And just because of certain candidates who have just nothing else to show except for negative campaign. So I feel sorry, but I hope they follow the code of conduct and be dignified in their campaigns. So coming back to the real issue, lack of apathy. That is the #1 reason, lack of apathy towards membership. They do not feel themselves as stakeholders. They feel they don't have a voice. We should work towards making this organization a member-driven organization and learn about their real issues, communicate and work towards providing valued benefits, resources based on their professional needs. Jab hum unke liye kaam karenge, they will come to us. And the second thing definitely is the lack of effective internal conflict resolution, use of pressure groups to influence results or outcome resulting in a less satisfied member, putting the organization to a risk for liability. Before the third-party arbitration, we should deal with complaints just like we deal at our workplace. There should be a detailed conflict resolution policy navigating conflict with a more of a remedial approach. Then we have the third thing, I think that is something important that we need to talk about, is the alumni politics. Though through alumni, we are able to give back to our homeland and our respective alumni, the alumni politics has used a lot of oxygen in electioneering. This hinders the growth of the organization. The real future of any organization is the work that they do at the grassroots level, where the organization is based at. For this reason, we must empower chapters to work at the grassroots level to create an impact on well-being of the local communities. Thank you.
Thank you, Dr. Lubna, to answer this question. Now we'll move on to second question. And this time I'll ask Dr. Lubna to answer this first. The question is, in your opinion, what are the three strategies Appna as an organization should adapt to be physically and financially viable in the future? Go ahead, Dr. Lubna, please, for 3 minutes.
Thank you. First, I would like to share my experience and then we'll talk about it. So we need to know that our meetings are practically the sole source of income to run the operations. During my treasurer year, there was a record meeting revenue of more than 1.5 million in 2018. Record market growth profit on asset portfolio, which later enabled the organization to utilize funds during pandemic. For the first time, we did comparative analysis of Appna asset portfolio with 5 big investment firms, Charles Schwab, Vanguard, Fidelity, Morgan Stanley, and Wells Fargo. Although it was a record success year, I realized what if, and it was before pandemic. I realized we should not put all our eggs in one basket. And at that time, I inaugurated Appna's physician career portal as a resource for job posting and practice development. We talk about TV, buildings, and all that, but please look no further. Your best resource is your own member. Provide them valued benefit and they will help the organization. Expand the physician career portal and operate professionally like New England Journal of Medicine. Increase its audience for who are looking for J1, H1 job posting, post for staff openings, search products and services, and buy or sell practice. We pay close to $3,000 for a 5-line ad in a New England Journal of Medicine. Again, this could be a resource. So please do not look any further. We must reach out to large groups emphasizing physician services and services that our organization is providing to the individual members. That'll be a great resource. Number 2, seriously create a policy and a standard of procedure manual for conducting Appna meetings to ensure stable growth. Either professionals or event managers should be conducting the meeting. There should be an oversight committee to review the track progress and minimize the risks. And third, but this is probably one of the most important we should emphasize, and that is empower YPC and create a clear database for all the students, young physicians, residents, and fellows, and make them members. They are our best resource. We are helping them become part of American fabric with the hope of becoming part of Appna's fabric. So these are, I think, important solutions, and I hope we adopt them. Thank you.
Thank you, Dr. Lubna, for answering this question. To Dr. Lubna, as a president-elect candidate, how do you feel about the existing election process and your suggestions to improve this process? Dr. Lubna, please go ahead.
Yes. Again, thank you, Sabahat. You're doing a great job conducting this meeting. So again, the guidelines should be the guidelines that candidate can abide by. And, there are candidates like me who try to follow the rules as much as we can. And then there are candidates, and, we are shortchanged when we start our campaign, however you allow us to do after a certain time. There was a candidate who emailed blast the entire membership last year that, that candidate is going to be the president-elect candidate for this year, which is utter, breaking the code of conduct. Similarly, it's just the negative campaigning from this one candidate has been unleashed on me, which has hurt, my reputation. And also, it has hurt my family. So, when we say we should just walk the talk and not just talk about it. And we should be dignified in our campaign. So I'm very, disappointed that, this is happening. However, coming back to the guidelines, the guidelines again, we need to either relax it or we need to not have these guidelines that, people just break and they come on and they say, and just, say that this is something that they also believe in that. However, my suggestion would be that allow these candidates to have a Zoom meeting because it is cost effective for the component society meetings when there's a component, so that they don't have to jet set. It's a lot of funds. Not everybody is so rich to spend that kind of money jet setting and meets and greets and whatnot. That should be done over a number of years, not the last minute. However, if we allow that to happen, just please, have a limitation on how much money one can spend on the campaign, have a quota for campaign funds. I would say Zoom meetings are effective, they're cost effective, and all these component societies, we should allow to present ourselves in Zoom meetings. Appna can conduct that, so each candidate has a level playing field. And another important thing I would like to highlight is the elections of board of directors and the president should not be run together.
30 seconds, please.
Because this pretty much favors the big alumni, and the small alumni candidates, they have compelling resume, but they are depending on the bigger alumni to make either alliances, which is against the spirit of elections. The elections, definitely, we should avoid that. So pretty much allow the candidates to do a campaign which provides equal opportunity and level playing field for all.
Thank you, Dr. Lubna Naeem. So now it is Dr. Lubna Naeem's turn for the closing statement. Please go ahead for 3 minutes. Thank you.
Thank you, Sabahat. I would say, like most of you, we came to United States for an opportunity and to acquire the best possible medical education and be the best doctors and be part of American legacy. For past 6 to 8 years, I've probably traveled to each state and met most of you to find out that your real issues are not so different than the other physicians. You raised this concern multiple times. Why is Appna not representing your real issues? And this sentiment was highlighted during pandemic the most, when you were struggling with PPEs, staff issues, loan programs, health concerns, burnouts, and deaths. The healthcare system problems we are facing have been faced by the physicians of the entire country. We should be at the table during debate on the healthcare reforms and all issues facing medical professionals. Remember, if we are not on the table, we'll probably be part of the menu. It's time we integrate with other professional organizations and have a seat on the table at AMA. It's time we raise voice against legislation on healthcare law, such as eliminating health disparities, urgent Congress to reject Medicare and Medicaid pay cuts, talking about South Asian health issues, talking about South Asian physician problems, protecting physician scope of practice. As president, we will work towards making this organization a member-driven organization and upgrade valued benefits and resources, especially to younger physicians, equal representation for women physicians in all governance strata, and equal opportunity performance-oriented committee structure, leadership education and jurisdiction of the roles without dominating the other, work on policy and procedure manual consisting with mission and bylaws. Continue all successful flagship projects of Appna and its alumni. The membership is exhausted with year-round electioneering. It takes too much of its oxygen. We need more volunteers than chiefs. Bottom line, there needs to be a paradigm shift. It's time we build bridges through the power of service and compassion. Our world is in need for more people who do things for the pure sake of helping one another, and we are in desperate need for such unity. We hope the direction of coming together, collaboration, and volunteering will influence to bring that positive change. In fact, the members are the true organizational leaders who help us pave our way to the future. We could not accomplish anything without your support.
30 seconds, please.
I asked you to stay engaged and help us shape and develop Appna into an institutional legacy. I am your candidate. Please vote for me on my proven success record. Thank you.
Thank you, Dr.